But one thing that I really focused on when I went to fellowship, which is subspecialized training, for 1 year, and I went to the University of Rochester in upstate New York, is focusing on hip preservation, and it's arthroscopic hip preservation. So again, using minimally invasive techniques in order to help preserve the hip joint. So this is most beneficial for people that don't have significant arthritis in the hip, because unfortunately at this point we don't really have a great way of replacing cartilage in the hip joint at this point. And so this is for somebody that has potentially a labral tear, issues with the soft tissues within the hip joint that we're able to repair arthroscopically. And a lot of people come to me with pain in the groin, would be most common, especially with activity such as trying to walk up and down stairs, even just walking on flat surfaces. Sometimes people will have significant groin pain. People will even complain of groin pain when they're sitting for prolonged periods of time.
So they can. So sorry to interrupt, but
No, you're good.
they can feel it. It may be related to the hip, but it's actually the pain is actually resonating from a different area that people might not know it's their actual hip.
So typical ball and socket joint pain in the hip actually occurs, and you will feel it most commonly in your groin. Now, some people will have presentation with lateral hip pain or posterior hip pain, but most commonly those are coming from different areas, potentially the back, the SI joints, potential problems with what are called the bursa on the outside of the hip. You can get a bursitis, things like that.